Today, I'm going to be talking to Professor Ian Goodman, who is a lead GP in Hillingdon Borough and now works at our medical school. I will be asking him questions about what you want to know about vaccination. Why students get vaccines if they still can catch COVID?
So we are seeing cases where people who've been vaccinated and fully vaccinated have caught COVID. But what we are seeing is if they do catch COVID, it's a much less serious condition then. It's not that common, but recently we've seen the numbers of COVID overall be as high as it was in the second wave, which is really very, very high, over 300, 400 cases per 100,000. But what we're not seeing is we're not seeing serious cases. There are very few cases ending up in hospital, probably less than 10%.
Where can students coming back to Brunel get jabbed?
So there's a variety of places in Hillingdon, and Hillingdon has got one of the highest rates of vaccination in the whole of London, if not the highest. So you can get vaccinated at some of the local chemists. The Boots in Uxbridge will do it. There will be some pop-up clinics actually held in Hillingdon itself and in the Brunel campus. Going to have some pop-ups, so there'll be plenty of places where the students can have their vaccination.
If an international student receive another vaccine and decided they want a UK approved vaccine, is that considered okay?
I think they'll have to take specialist advice depending on the vaccine that they got originally, because some vaccines are very effective, but others don't seem to be that effective. So for each person, they'd have to actually ask their occupational health for the advice on that.
And so what are those vaccines which are effective and which are...
Well, the ones that are produced by AstraZeneca and Pfizer, BioNTech, the Chinese and the Russian ones we're not less sure about because the data from there isn't as robust.
What else students be doing to stay well during COVID?
Okay, so even if you've been vaccinated, it's important to keep the infection protection measures going because, as you said earlier, it's still possible to catch COVID again. It's the usual advice that we gave before. Keep your distance if you can, wash your hands, and wear a mask indoors because we know that viruses stay around in enclosed environments, and if the air doesn't circulate, then it's a good area to actually pick up COVID. Washing hands is important, not just for COVID, because we're seeing that other viruses are now coming back, and washing hands is a great protection to stop that spread.
Would you recommend students to still wear a mask?
Only indoors for the moment. There's very good evidence that you don't need to wear masks outdoors because of the circulation of the air. But if you're in an enclosed space with lots of people and just one or two of them could be a carrier of COVID, then they'll be breathing out droplets with thousands of the COVID virus in them. And by wearing a mask, you prevent the droplets being spread.
Locally in the borough of Hillingdon, is there high intake of vaccines among young people, 18 to 23?
So overall, there's a very high uptake of the vaccines. In fact, Hillingdon has probably the highest in northwest London and possibly the whole of London. The 18 to 20-year-olds are catching up. We started much later because that was the government's requirements, but we're catching up quite nicely.
Oh, that's really good. And if there's a COVID patient, what kind of dietary restrictions are on them?
There's no need to have any dietary restrictions if you are a carrier of COVID or have COVID. You should drink plenty. You should contact your GP if you're getting symptoms the first instance. And we have systems in place where we can monitor patients with COVID at home with oximeters, measuring their oxygen to make sure that they're not getting into any problems.
Okay, thank you so much, sir.